Today I'm going to talk to you about the proper way to handle insulin, to give a proper injection, and some at-home glucose monitoring that you can do on your pet that has diabetes. Controlling diabetes can be fairly simple, and it can easily be done at home, and your pet can have a happy, healthy life at home even with diabetes. The first thing I want to make sure you understand is your insulin for your injections is going to need to be kept in the refrigerator. It's very important that it's kept in there, and when you pull it out to give the injection, you don't want to shake it. You're going to have to mix it, but what you're going to do is put it between your hands and you're going to gently roll it back and forth. And the reason we do this is because it's a suspension, and if we shake it real fast, what's going to happen is you're going to get a whole bunch of air bubbles in there, and then that's going to get air bubbles in your needle. It's going to mess the suspension up, so you don't want to do that. So you just want to gently roll it between your hands. Once it's mixed, you're going to invert it like this. If you see anything in the top, it's not mixed enough. You're going to have to do it some more, but it's okay. So you're going to take your needle, and you're going to match your needle up to your concentration of your insulin. You're going to remove the bottom, which is going to show the plunger. You remove your top to where your needle is. Okay, now, before you put it in, you want to make sure that you pull your plunger back to however many units your medicine's going to be. So, for instance, she's going to get 3 units, so we're going to pull it back to the 3 before we insert it. And the reason we do this is because then when we put it in, we're going to push that air up into the insulin. It's going to create that negative pressure so we can pull it out and it won't be a vacuum in there. So now we're going to insert our needle. Be very careful. It's a very thin needle, which is another reason why dogs tolerate and cats tolerate this very well, because they can barely feel it because it's such a small needle. Okay, so now you're going to pull it back to what you need. Once you got it pulled back, if you see any air bubbles, you can just give it a quick flick and then pull it out. Okay. Now, to give the injection, you're going to want to go right between the shoulder blades, and you're going to pull the skin up like a tint. So you're going to tint the skin. Let me see if I can get this angle a little bit better. Right between the shoulder blades here. When you tint it up, you're going to insert, your needle's going to be approximately directly against the, going vertical across the shoulder blades, and approximately a 45-degree angle. So you just insert it in, deliver it, pull it out, rub it a little bit, and that's all. Then you can give them a nice big old petting, tell them how good they done, and give them a treat. And that's all you need to do for your insulin. Now, after you do this, you always make sure you cap your needle and dispose of it in a proper receptacle. Another thing that you want to make sure of is you want to make sure before you give your insulin shot that you want to make sure that your pet is alert. You want to make sure that they're not showing any signs of dehydration. And there's a couple different things you can do to make sure. You can make sure they're acting right, make sure they're alert, make sure they're acting in a normal way, make sure their eyes aren't sunken in. You can also tell by looking at their gums, and you like where it's pink, and you can kind of see if that looks dehydrated by touching on that and see how quick it gets real good and pink, and make sure it's not pale or anything like that. That's just a good sign of dehydration. You also want to make sure that they're eating, because if they're not eating right, then you don't want to give them their insulin shot. So if they're not eating, don't give them their insulin. If they're not alert, if they ain't got pink gums, don't give them their insulin. You want to contact your veterinarian and let them know what's going on before you do anything like that. And the last thing I want to talk to you about is monitoring glucose levels at home. And you can do this with a monitoring kit, which comes like this. And this is the monitor kit here. This right here is where you put the lancet in, and then the test strip. So it's very simple to do. You just take this is where you put your lancet in. So all you're going to do is you're going to take your lancet, and you're going to put it right in here like this. Okay, and when you push that down, it's going to cock it back. You're going to take off the top. This is going to expose the needle. Be very careful. Put the top back on. Okay, and now it's ready to go. Okay, you're going to take your testing strip, which looks just like this. Your monitor. Okay, now what you're going to do is, you put it in, and it's going to go ahead and it's going to calibrate and get ready to go. See, so it's ready. But what I do is just, until I get the blood, I pull it out just a little bit. So it's not on yet, but it's still in there. Set that to the side. Now you can test in a couple different locations. You can test on the pinna, which is right here on the inside of the ear, is a good place to test. You want to test different spots every time, kind of mix it up, just so that one spot don't get sore. The same thing with the injections. You want to do it in slightly different locations. You don't want to do the exact same spot because it's going to get sore for them. So you alternate. Another place you can do it is on the tail. So you can do it right here on the tail. If they got really long hair, you might want to just shave a little spot and kind of keep it within the general area. You take it, you push it against here, and you just push the button. Oh, and that's it. And then as soon as that's done, you push, get a little bit of a blood draw. Okay, now at this time I'm going to push it in. So it's ready to go. Okay, and I'm just going to get the little blood drop in here. And then it'll fill up, and then it'll tell us the reading. And this is a good way to always monitor your pet. You want to do this every day. And just make sure that they're staying within the normal ranges. And if anything comes up, if you have questions about anything, and if anything concerns you, always contact your veterinarian and they will be able to help you. Thank you for watching.